Looking at him now, you would never know he was very near death Tuesday. He had fallen into the family swimming pool. His mother, Tammy, found him floating in the water and, in desperation, phoned the 911 emergency dispatcher.
Do you have him out of the water?
Yes.
Okay, do you have to do CPR?
No.
Okay, ma'am, you're going to have to take a breath to calm down.
At this point, County Fire Dispatcher Boyd Cole knew that precious seconds were ticking away.
I was thinking about my 2-year-old and our pool and whether my wife would be able to do it or not.
Finally, little Andrew began to breathe on his own. An ambulance arrived just 4 minutes after the call, and he was rushed to the hospital. He's now in good condition and is responding well to treatment.
The incident we just saw had a happy ending. But would you know what to do if you found your baby or child unconscious, not breathing, or without a pulse? Every second counts during this type of emergency. Knowing CPR could mean the difference between life and death. Brain damage will begin to develop if a baby or child is without oxygen for 4 to 6 minutes. A baby's or child's chance for survival increases significantly if someone gives CPR promptly and correctly. To prevent injury, you should never practice CPR rescue breathing or chest compressions on another person. This is why we're using a mannequin to demonstrate certain techniques. When a child appears to be unconscious, you must first verify this condition by gently shaking the shoulder.
Are you okay? Are you okay?
An unconscious child will not awaken, and the arms and legs will be limp. If the child does not respond, call out for help.
Help! Help! Somebody help!
If someone arrives, send that person to phone for emergency medical help. Obtaining professional medical help as soon as possible is of the utmost importance. Call 911. When you are alone with a child victim, perform CPR for about 1 minute. Then, if a telephone is easily available, quickly phone for emergency medical help and immediately resume CPR. If a telephone or help is not available, continue CPR. A rescuer can give effective CPR only if the child is lying flat on his or her back on a firm, level surface, such as a table or the floor. If you need to reposition the child, support the head and neck with one hand and carefully roll the entire body towards you without twisting it. Do not prop up the head. Next, begin CPR by using the ABC steps: airway, breathing, and circulation. Step A, the first step, is to open the child's airway using the head tilt chin lift maneuver. Usually the tongue is the most common cause of a blocked airway in an unconscious child. To begin, tilt the child's head back by pressing on the forehead with one hand. Next, place the fingers of the other hand under the jaw on the bony part of the chin. Avoid pressing on the soft tissue under the chin, as you may accidentally block the child's airway. To complete the airway opening maneuver, gently lift the chin upward. Step B, the second step, begins by checking to determine whether the child is breathing. Keep the child's airway open. Put your ear directly over the mouth and nose to listen and feel for breathing. At the same time, also watch the chest and stomach for any movement. Look, listen, and feel for breathing for 3 to 5 seconds. If the child is breathing, keep the airway open until help arrives. But if you do not hear breathing, do not feel exhaled air on your cheek, or do not see the chest rise and fall, you must keep the child's airway open and immediately start rescue breathing. Pinch the child's nostrils with the fingers of the hand that is maintaining the head tilt. Take a deep breath. Seal your lips around the outside of the child's mouth, creating an airtight seal. Then, give 2 slow breaths, known as rescue breaths. Allow 1 to 1.5 seconds for each breath, with a pause between the breaths for the rescuer to take in fresh air. Out of the corner of your eye, watch the child's chest. If the chest rises and falls, you'll know that your rescue breaths are effective. Give only enough air to make the chest rise and fall. If you meet an airway resistance when administering the 2 initial rescue breaths and do not see the chest rise, you must reposition the airway and try again to give the rescue breaths. If you still meet resistance after repositioning the airway, a foreign object, such as a hard candy or a small toy, may be causing an airway obstruction. Before continuing rescue breathing, you would need to remove the foreign object from the airway. Later, we will show you how to do this. After successfully giving the 2 rescue breaths, Step C, the 3rd step, which is circulation, begins by feeling for a pulse. To check the pulse of a child, place your index and middle finger on the child's windpipe. Do not use your thumb. Slide your fingers to the side of the neck. Gently press in against the soft part of the neck in the groove next to the windpipe. Check for a pulse for 5 to 10 seconds. When there is a pulse, but the child is not breathing, only rescue breathing is necessary. Give 1 rescue breath every 3 seconds or 20 times a minute.